by the alleged failure of the federal government to meet its demand, the National Association of Resident Doctors has embarked on a 5-day warning strike starting from Wednesday, May 17th to Monday, May 22nd. The National Executive Council, NEC, of the association, which gave the mandate of the association in a warning of the mandate of the association to proceed on a warning, had earlier issued a 2-week ultimatum on April 29, 2023 to the federal government to commence implementation of all pending agreements. As part of the agreement, the resident doctors want an immediate increment in the consolidated medical salary structure, CONMENS, to the tune of 200% of the current gross salary of doctors, withdrawal of the 5-year compulsory service bill at the National Assembly to enable access to medical license, strengthened the recruitment of health workers at health facilities across the board, and infrastructural development, as well as clearing of unpaid salaries at the state level, among other demands. The federal government, through the Minister of Labour, Chris Ngige, had described the 200% salary increment demand of the doctors as ridiculous and the 5-day warning strike unnecessary.
Priority, and I want to say that if you recall, we've not gone on strike for close to 3 years now, and I think our members have exercised some patience. That's what they feel. They have been patient enough with this government, trying to see whether many of these challenges can be resolved without having to go on strike. And in fact, they are believing that maybe that was a mistake, because for these 3 years, these things have not been addressed. And that is what has brought us to this unfortunate end. And people have to know that the warning strike was a compromise decision. We had the option of going on indefinite strike, but we considered Nigerians who incidentally we feel this fight is for them, because they are the ones accessing these facilities. They are seeing that it is becoming increasingly more difficult to access healthcare, to see your doctors, to see the nurses, because nobody, many people have left. You now have one doctor doing the work of many. In our accident and emergency department all over the country, where you need to have 10 doctors, you have 1. And of course, people are dying from this. So we want the government to address this challenge. They should improve on the condition of service so that our doctors will stay here. So this warning strike is for 5 days. And after the 5 days, our members have said that we have to come back and review. And if no progress has been made, nobody should blame NAD if we end up with an indefinite strike.